Before we start, ladies and gentlemen, I would just like to acknowledge the traditional owners of and custodians of the country throughout Australia and their continuing connection to land, waters and community. We pay our respect to them, their culture and elders past, present and future. Ladies and gentlemen, my name is Cormac Lennon. I'm a student ambassador here at Macquarie University. Well, not here at Macquarie University, as many things are being done these days. This is being done remotely. We have a few people on campus live in our studio, but I'm joining you in whatever way I can. I'm in my second year of a Bachelor of Psychology and a Bachelor of Laws here at Macquarie. So I'm in my undergraduate phase of my psychology journey. I'll be helping moderate this session for you guys today who are trying to learn a bit more about postgraduate psychology. So I'll be taking all your questions and throwing them to our different panelists who know much more and are much more experienced with the postgraduate aspect of Macquarie University psychology than I am. Essentially, today's session is giving a snapshot of the postgraduate psychology courses we have here at Macquarie University. And we really want to be able to showcase the career options for you guys, the future opportunities that lie awaiting for you if you're willing to undertake a postgraduate psychology degree at Macquarie University. I mean, I've loved my study of psychology so far, so I'm actually looking forward to hearing more about what postgraduate opportunities may entail as well. So both me and you guys are here on this journey together, which is really, really exciting. Essentially, what we've got set up for you in this webinar is firstly a presentation from Associate Professor Joanne Earle, who's the course director of the Master of Professional Psychology. And Joanne will provide a quick overview of the courses offered here at Macquarie University. Following that presentation, we're going to have a little panel discussion with a couple of special guests who are alumni of the Masters of Professional Psychology here at Macquarie University to hear a bit more about their personal experiences and journeys with their postgraduate studies. And then we'll round out the webinar with a Q&A session where we'll try and answer as many of your guys' questions as possible. But without further ado, I'm sure you guys are sick of listening to me talk, so I'm going to hand it over to Joe, who will take you through what postgraduate psychology at Macquarie University looks like. And remember, put as many questions as you can in that Q&A function down below throughout the presentation. All right, over to you, Joe.
Thanks very much, Cormac, and welcome everyone. Thanks for joining us this evening. I'm just going to give you a very brief overview of our programs here at Macquarie Uni because I really want you to hear from two of our graduates, Maddie and Adam. So my role is as Program Director for the Masters of Professional Psychology, but I also have oversight programs at the University in Postgraduate Psychology, so I'm able to answer some of those questions for you tonight. But I'm also in the presentation included details of all of our program directors, and I would really love for you to reach out for them if you've got more specific questions about a specific program that you're interested in. Then you'll have their details. Please email them. They're more than happy to respond to your individual questions, so please do that. So you probably already know that you want to be a psychologist, and we're very fortunate here at Macquarie University to have 4 different options for you in terms of pathways. So the generalist pathway, clinical neuropsychology, organisational psychology, as well as clinical psychology. Now, it's a little bit confusing as to how you go about becoming a psychologist, so I thought I'd lay it out for you today. This is one of the frequently asked questions that we get. Essentially, there's 2 main pathways that you can do. You can either do a 5+1 pathway, which means that you're with us here at Macquarie for just 1 year, and that's our Master of Professional Psychology. Or you might decide to do a standard 2-year program, in which case you'd be looking at an area of endorsement in clinical neuropsychology or organisational psychology. So entry into any of these programs is via the Bachelor of Psychology Honours. So you've got to have a good honours degree before you can access any of these different pathways. But you'll see here on the diagram that I've mapped out for you, those different pathways. So just to reiterate again, Master of Professional Psychology, 1 year here with us at Macquarie University, and the Master of Clinical Neuro, Clinical Psych and Organisational Psychology are both 2-year programs. All of our programs are accredited by APAC, which means that they'll all lead you towards registration. So I'm going to take you through each one of those programs in a little bit more detail, so you've got a bit of background, and then please do follow up with the different program directors. So I'm actually the course director for this program. So if you're interested in the 5+1 program, then please contact me. I guess some of the highlights of this program you can see from the slides, but more generally, there's no thesis component in this program. We also have a 300-hour placement that's organised for you, so you don't need to do that yourself. It will lead you into a wide range of different career options. And two of our graduates are here to talk to you today about that. You attend workshops twice a week, generally on a Wednesday and a Saturday. And this will lead you towards a generalist career path. So you do 1 year with us and then you spend a 6th year out in a workforce. The other 3 programs I want to spend a bit of time on have the same sort of basic structure. They're all coursework programs. There is a thesis component, but the good news is, as opposed to maybe your honours year, you get to choose a topic that you're interested in and aligned to a supervisor who's potentially been doing research in that area for a long period of time and is most likely to be registered as well. That's one of the features of our teaching staff here at Macquarie. Most of them are scientists, practitioners. We also organise placements for you. So there's a lot of hours of placement, 1,000 hours altogether, and we organise those placements for you, with the first one being in our clinic on site here at Macquarie University, and that's been operating throughout COVID. All of our staff are research active. They might also have private practice loads or consulting work, and this helps to inform their teaching and supervision. So the first program I'm going to talk to you about is clinical psychology, and you'll see Carolyn there is the program director. Please feel free to reach out to her. The clinical psychology course is one that you would do if you're interested in complex presentations of clients, diagnosis, assessment, designing intervention plans and follow-up. Most likely to be employed in a hospital, could be in schools, it could also be in private practice. Many of our students will go on and set themselves up in private practice. So please contact Carolyn if you're interested in her program. Our clinical neuropsych program is directed by Jenny Batchelor, and you're most likely to go into work in clinical neuropsychology if you're interested in any aspect of the brain, whether it be recovery, it could be diagnosis, a lot of assessment work. You could find yourself working in a specialist brain injury unit or a rehab unit, for example. Those would be typical types of placements, and then employment for a clinical neuropsychologist. This is a growing area, and I guess if we look to the future, in 11 years' time, about 1 in 4 people is likely to be over the age of 65. So we see things like dementia assessment taking priority as we go further into the future. We also have a Master of Organisational Psychology, so anything to do with workplace health, well-being, human factors, training and development, selection, recruitment, training, all of these areas are covered in our Organisational Psychology program. It's an award-winning program. It's been recognised with the Vice-Chancellor's Award. Our staff also have consulting loads, and they're doing research, applied research in a wide range of areas relating to organisational psychology, and Ben would be delighted to hear from you. If you've got any interest in organisational psychology, then reach out to Ben. Lastly, some frequently asked questions that I often get asked when I do presentations like this. What are we looking for? Well, we're looking for students who've completed an APAC accredited 4th year of study in the last 10 years. You should have at least a 2-1. Preferably a first class honours result. But if you're uncertain about your honours result, please apply. We'll help you to work through that, and you are very likely to get shortlisted without us having access to your honours results. How competitive is admission? Well, it's very competitive, but that shouldn't discourage you. What's our fee structure? Well, it's a full fee paying program. You might be eligible for Austudy. There might be some CSP places available for clinical psych, clinical neuro and organisational psychology. Our employability of graduates is excellent. If you have a look on the Quilt data, it's about 91% of our graduates are employed. on completion of the program. You can study part-time if you want to. Is there a mid-year intake? No, unfortunately not. It's a pretty intense, our training is pretty intense. There's a lot to cover in 2 years, and it needs to be done in a fairly systematic way because some subjects will inform others. You can combine a PhD with clinical psych, clinical neuropsych and org psych. You can't do that in the MPP. If you want to do that pathway, you'd have to have a very good first class honours result and overall distinction average in the first year of your master's course. Is IELTS required? It is required for international students. I would suggest that you make sure that you've got an up-to-date IELTS test before you put in your application. If you've studied overseas, you should get your application, your previous studies approved before you put in your application so that we can check for equivalency. It will just make things a bit faster at your end. So how do you apply? Well, through UAC. There's also a supplementary application form that needs to be filled out, and we need 2 referees' reports. We tend to shortlist as soon as the closing date, which is October 31st, and then we call people to come in for either interviews for the clinical neuropsychology or what we call the MMI, which is a mini interviews for the other 3 programs. It's a bit like an assessment centre, and each program offers 20 plus places. We can take up to about 30 students in each of our programs, so we're really looking forward to hearing from you. And those are the questions for me. Back to you, Cormac.
Thanks very much, Jo. Hi, everyone. I'm back here again. Well, yeah, thank you so much for that. That was really, really interesting. And now I think I will introduce Adam and Madeline. So if you guys can reveal yourselves by switching on your cameras and your microphones. Yes, so Adam and Madeline are both alumni of Macquarie University Masters of Professional Psychology program. And we're very grateful to have them here today. Thank you guys so much for being here with us. We might start with you, Madeline. Can you tell us a little bit about yourself and your current work in the field of psychology?
Yeah, absolutely. So hi, everyone. My name's Maddie. I'm a provisional psychologist doing the 5-in-1 pathway. I did the 5th year at Macquarie Uni as the Masters of Professional Psychology. So I am completing my internship year at the moment. I have actually finished all of my hours. I'm just waiting to sit the National Psych exam in November, and then I'll be applying for general registration. I work as a school counsellor at Shaw Senior School in North Sydney. And as a school counsellor, my role is pretty varied. And it involves sort of a range of different activities. Did you want me to talk about what I do on a day-to-day basis, or is that going to come up next?
I'll come back to you for that one because I do want Adam to be able to introduce himself as well. Adam, can you tell us a bit about yourself and your current pathway in the field of psychology?
Yeah, for sure. So yeah, hey guys, this is Adam. So I'm the exact same as Maddie, to be honest. I did the 5+1 program with Jo last year. So I'm a provisional psychologist currently working at the Ryde Community Mental Health Centre. So yeah, I work in community health. So for those that don't know, it's kind of an intermediary between the private sector, so things like private psychologists or other private clinicians like social workers and stuff like that, and the inpatient mental health unit. So we typically deal with pretty acute mental health concerns. Often it's clients who have been in an inpatient setting and then they're coming for us as a step down, or it could be clients that have been in the private sector and their needs become a little bit too acute for private clinicians to manage, and then they refer on to us for support. So yeah, in terms of the my provisional registration, not quite as far along as Maddie just yet. So I've still got a few more hours to do, another case report to do, and then I need to sit the exam as well. So I've got most of my hours done, most of my supervision done, but yeah, still a little bit to go.
Yeah, thanks, Adam. So Maddie, can you, going back to your experience at Shaw, can you tell us a bit about what you do on a day-to-day basis? So it's 9 a.m. Monday morning, or probably earlier than 9 a.m. for a school. You walk in and what are you confronted with straight away, and what do you have to deal with throughout the day?
Yeah, a school is an awesome environment. It's a community and it's very interactive. Things are always happening and changing. So I can never predict perfectly what my day is going to look like because things happen and students drop in. But my primary responsibility is the direct counselling to students in the school. And that can look like a range of things. Sometimes it's assessment for educational purposes. So you might have a student who's really struggling. They're performing down the bottom of their year and we're not sure why that is. And so I might do some sort of in-depth psychometric testing around whether they have a specific learning disorder that's impacting them, or screen for things like ADHD that might be the cause of their disengagement at school. Other times it's dealing with social, emotional, behavioural concerns. So students who are presenting as anxious, depressed, or who might have stuff going on at home that's impacting them at school. It's my role to assess that situation for them and engage them in counselling to optimise their functioning at school. If their issues sort of go beyond the scope of school-based counselling, it also involves referring them to community-based psychologists, paediatricians, psychiatrists, if necessary, and then being that point of liaison between external people who are treating the mental health concerns and the school, so that we're making sure that we're giving consistent messages and providing support. And obviously it also involves a lot of work with other stakeholders in the student's life. So working with their parents and working with the teaching staff to understand what needs to be in place in the classroom to support students.
Yeah, fantastic. Adam, I'll get to you in a second to ask about, because I imagine your experience would be somewhat different working in a community health centre. But Maddie, I'd love to ask, and I'm sure something that might interest our viewers here today is, how did you go about your role as a school psychologist in the middle of a pandemic when no one was at school?
Yeah, that's a great question. Essentially, when schools shut down, we moved to telecounselling. So we were just doing our sessions with students via Zoom. And classrooms were also a bit different as well. Classes were being done on Google Classroom or via Zoom as well. So the way that we would engage with teachers and parents was also via Zoom for the most part. But it was kind of business as usual. It was just everything was online. Yeah,
but I can imagine it would be a bit better now that things are somewhat less online and more in person.
Yeah, there are definitely aspects of the role that are much harder to do online. A lot of students that are referred to me, I want to go and observe them in class to see how they interact with their peers and their teachers. So that was really hard to do.
For sure. Yeah, right. And Adam, what about you? What does a typical week, a typical day look like for you working in a place like you do?
So I might just first preface by describing the type of clients that we typically work with. So in community mental health, like I said, they're quite acute clients. So it can be anything from sort of mood disorders like depressive disorders, anxiety, bipolar disorders, to anything like psychotic illnesses, so things like chronic schizophrenia. Also a lot of work with people with personality disorders. So typically anything where there's like sort of suicidal ideation, self-harm or psychosis involved. And a typical day for me, it starts, get here at 8 o'clock in the morning. We have handover meetings twice a day as part of a multidisciplinary team, which consists of psychiatrists, psychologists, social workers, mental health nurses, occupational therapists. It's really diverse. We basically discuss all the clients on our books at that time and allocate jobs for the day. So jobs can take the form of attending to things like crisis calls. It can be attending up to the emergency department to complete an assessment. It can be sitting in on joint reviews with psychiatrists, conducting home visits out in the community. There's also, slightly separate from my work, but there's also case management where you're working with clients ongoing, incorporating things like applications for things like NDIS and stuff like that.
Sure.
We also do like brief intervention counselling here as well, which is, it's a 4-session protocol specifically for people with personality disorders that have been to hospital recently. And we also have a dialectical behaviour therapy program as well. So that's a specific treatment modality, like the gold standard treatment for individuals with borderline personality disorder. So we do that as well, and I'm co-facilitating that program at the moment.
Yeah, great. No, that's really interesting. I think the interesting thing I found with both your answers was despite both working in very different areas, the very interdisciplinary nature of your work. I think sometimes people might perceive a career in psychology as being alone, sitting in a room, talking to one person at any one time. But both of you, obviously in different forms, are constantly trying to engage all the stakeholders involved with an individual person's life. Was that a part of your study in postgrad at Macquarie about learning to engage and work with other fields and areas? Is that something that you've more learned just as part of the work experience that is integral to that postgraduate study?
I can give a go at answering that. So,
sure.
As part of the masters, I think you become increasingly more aware through the course that, psychology isn't just due to individual factors, that we are a product of our environment and things around us. But I think it's more so consolidated once you get into placements and you get into the workforce. You start to realize that, hey, a person presents the way they are because of a multitude of reasons, and it, can be individual psychological factors, but it's often, all the things around them as well. And I think that's really consolidated once you get into the workforce. You can learn about it in theory, but I think the practical placements are just invaluable in that respect.
Did you find the same, Maddie?
Yeah, definitely. There's aspects of what you learn in the theory of working with clients, like it might be something like family systems theory, where you're looking at the fact that an individual sits within a context. They're not ever just a totally isolated individual. And so understanding how there are other people in their lives that are impacting their mental health and their response to the situation. So I think if you can engage others, that can be a really helpful approach. But in terms of working as part of an allied health team, like Adam said, that really comes out in your prac and your placements. Yeah,
absolutely. And Joe, do you find the same in terms of how you design the program, your professional psychology program, that it's essential to have that industry experience to understand how you kind of take the theory and apply it beyond the books?
Yeah, definitely. And I guess one of the things that's different about postgraduate psychology training, particularly here at Macquarie, is that we've got a big emphasis on life skills and development of skills, as opposed to just learning theory and doing exams. A lot of the work that students will do will be practicing the skills that they're going to be using when they get out into the workforce. And the other way that we help to bridge that gap is through placement. So students do 300 hours of placement, and during those placements they get the opportunity to try out some of these skills. And it would be interesting to hear from Maddie and from Adam about how placements featured in terms of their, career journey. Maybe Maddie, would you like to speak to that?
Yeah, absolutely. I completed my placement as an intern at Knox Grammar Senior School. I had said to Joe and the placement coordinator that I really wanted to gain some experience in a school, and they were able to help me engage that placement. And that was a really wonderful experience. It was sort of a mixed role where they had some clients that they had prepared for me to treat, where they sort of had some, they know you're starting out and it's your first practice, some more low-level anxiety and depression clients that I was doing treatment with. And then I was also helping them run a group. And then when you're an intern, often you're on call for drop-ins too, which is great experience because you just have to hone your counselling skills without knowing what you're going to get when a student drops in. But I was really fortunate because at the time that I was about midway through my placement, one of the junior school counsellors at Knox announced that she was pregnant, and they were hiring for a maternity leave position for her, which I applied for and was the successful candidate for. And it's interesting because obviously there were other people who applied for the role who were fully registered and had, greater experience than me. But being there as an intern, I already knew the school system. I knew the staff. I had good relationships with the team, and I understood the culture of the school, which I think is what gave me an advantage. And actually temporary roles can be a great way in, because in all honesty, if it was a permanent position that they were advertising for, they might have chosen someone with more experience. But I think because they knew it was just a 1-year role, and they knew that I already was upskilled in how to fit in with their school system, they were able to give me that opportunity.
And, well, Maddie, you seem to be cutting out a little bit. You seem to be cutting in and out of a little bit there. So I think we caught the tail end of that. So maybe we could hear from Adam along the same sort of lines as what Maddie was saying. How did placements feature in your sort of career journey, and how you got to where you are now?
Yeah, so my journey was actually very similar to Maddie in some respects, obviously different areas, but I initially did my internship or my placement at Ryde Community Mental Health, where I work at the moment. It was only supposed to be half a placement, about 150 hours, because my supervisor was actually going on maternity leave as well. So I completed about the 150 hours or so. And then I actually swapped over to Knox as well, so where Maddie was working. I was only there for a few weeks, and then Ryde contacted me and said, look, there's a temporary position that's become available. Would you like to come back and apply for it? So I went back, I applied for it. Same as Maddie, I think there would have been clinicians with far more experience than me that went for the role as well, but I ended up getting the job. And I think, yeah, as Maddie was saying, I think that's due down to, me being familiar with the team. They knew who I was. I think there was a cultural fit. I got along with the team well. And I think just wanting to make an impression with the team, I tried to work as hard as possible. So they knew me, and the temporary role really assisted in getting that initial job. And then from there, so they opted to extend my contract. So it was initially only for about 6 months, and then it got extended out to a year. And then a full-time position became available. A permanent full-time position became available. So yeah, I'm permanently here now. So
fantastic.
Yeah, so it came out of the temporary position again, as Maddie said. But yeah, it came out of the placement.
So some really good quality placements, and they seem to be translating into employment for you. So that's obviously been one advantage, but I've always wanted to know from both of you, why did you choose professional psychology at MQ? Because you both got good honours marks. What made you choose professional psych at MQ? Maddie, do you want to start?
Yeah, I can jump in on that, and sorry if my internet has been a little bit dodgy.
That's right.
Look, there were a few reasons why I chose the Master of Professional Psychology. I obviously knew I wanted to be a psychologist, but at the time of finishing my honours, I wasn't sure what kind of psychologist I wanted to be, whether I wanted to work in a health setting. I was interested in young people, so I was thinking about schools. But I was really looking to have a broad range of skills that could be applied to a number of different settings. I didn't want to narrow things down too much. So for me, pursuing general registration was what made the most sense. I wanted to have that broad scope and ability to apply to, a few different settings. I was just itching to get practical. I wanted to be a counsellor. I wanted to be out there working with people. And so for me, I was looking for a program that would upskill me to work as quickly as I could, and that would sort of avoid more time spent on theory or doing the research stuff that I decided wasn't really my cup of tea.
Excellent, thank you. Adam, what about you?
Yeah, I'm probably just going to have to echo what Maddie said, to be honest. Same thing. I knew I wanted to work in the field of psychology. I had no idea what type of psychologist I wanted to be. I was flirting with the idea of becoming a clinical psychologist, a sports psychologist, organizational, but pretty much everything. So I didn't want to sort of go down one route and do the extra study and the extra registrar program unless I was 100% sort of in it for the long term. So yeah, that was pretty much the reasoning behind it. And I had a lot of good feedback from previous students as well, saying you got a lot of general knowledge, general experience. You're able to get into the workforce quite quickly. So yeah, that was what was enticing for me.
And why Macquarie? What attracted you to study and stay at Macquarie for your postgraduate?
So I mean, through undergrad, I always thought Macquarie was a really good university. I mean, all the lecturers, all the conveners, all the academics that I worked with, I think they were quite well regarded in their field. They're obviously very intelligent, hardworking people that, I learned a lot from. The content was easily accessible with like the iLearn platform. I never really had any like technological issues. The campus is great. It's a good library. I just really didn't have any issues whatsoever at Macquarie. It was all quite sort of straightforward. Learning was easy and it was easy to engage with. So it was just a convenient choice for me.
And what about you, Maddie? What attracted you to Macquarie?
Macquarie has a wonderful reputation in their psychology department, and I had multiple psychologists who were working in the field tell me, study psychology at Macquarie. And I was told that when I was doing my HSC and I was looking at applying for undergrad psychology degrees. There are higher ATAR entry points at, I think, University of Sydney or UNSW. And so I initially put my name down for those, thinking it must be better there. And then had psychologists say to me, go to Macquarie. If you get the chance, go to Macquarie because they're really well reputed. And the feedback that I was getting was that Macquarie's programs are the most practical and emphasize the most practical skills and application of theory into practice. So I did my undergrad at Macquarie, loved it, thought the department was great, really awesome lecturers and staff. So I just wanted to stay on and do my postgrad there as well.
Well, we're glad that you did, both of you.
And just to echo what Maddie was saying as well, when I came to write on my placement, my supervisor gave me feedback from the previous Macquarie student from the year before. And also when I went to Knox, I actually got good feedback about Maddie from that supervisor. So there's this kind of interrelated link of, hey, Macquarie University students are actually quite good. We think we actually want to pursue having them in the workplace. So I think there's definitely a good reputation there.
Excellent, thank you.
Definitely. I mean, I just as an undergrad student, I can say that, like second what you guys are saying, or third, considering two of you said it. Like I've loved my undergrad study at Macquarie. The lecturers have been great. They're all diverse, all different, and have different ways of teaching, but many of them are very passionate about what they're teaching and are really looking to engage students even more so, and kind of pass on their passion and their knowledge, which I've really enjoyed our studying. So I'm looking forward to hopefully being in your guys' shoes one day, which would be really, really cool. But I think we've got some time now to answer questions from our wonderful audience here today. So one question we got right at the start, and Joe, you touched on this in your presentation a little bit. For international students, we have Kiatana from Singapore, who says she doesn't have a psychology degree background, but she is a behavioral scientist. And she's thinking the work experience might be relevant, but she's also doing a postgrad diploma in psychology with JCU, and was wondering if that would support her application to do a master's here at Macquarie.
Sure. So the thing to check is that if the course at JCU is an APAC accredited course, then that would be considered an equivalent fourth year program, and then we would be able to consider your application. So that's the key really, and I couldn't tell you off the top of my head if the JCU course is APAC accredited, but if you email me, and you'll see that I put my email address in the slides before, then I'll investigate for you and let you know whether or not it's on the APAC list. The other thing is, if you're coming from an international university, including Singapore, then you need to have an IELTS test. And any undergraduate qualifications you have should most likely be approved by the APS. But that may have already been done when you joined JCU anyway. You might have had to have gone through that process and gotten some of those things already sorted out. So that might be fairly easy for you to get access to again. But if you'd like to email me, I can give you a bit more information about whether or not that course meets our requirements for entry.
Fantastic. Thank you. Thanks, Joe. We've got another question along the same line. I think there's a bit of a common thread that might be amongst our participants here today. If they don't have an undergraduate background in psychology, what do they need to do, or what are their chances of getting into a psychology master's program?
Yeah, unfortunately in Australia, the only way you can become a psychologist is if you've done a 4-year undergraduate degree. So you have to have an honours degree or at least an equivalent to be able to train as a psychologist. And that's the same for all postgraduate courses across Australia. And that's not a requirement that we set, that's a requirement by AHPRA, who is our health authority, and they make a decision about what sort of training someone needs to have as a basic foundation to become a psychologist. So you do need a 4-year undergraduate degree with an honours degree or a 4th-year equivalent in psychology.
So what would be an example of a 4th-year equivalent? So would that be like a graduate diploma or something like that?
It could be a graduate diploma. That's the best way to check, Cormac's actually to go to that APAC website. Yep. So the Australian Psychology Accreditation Council have a list of courses that meet that criteria for the 4th year, what we consider an equivalent 4th year, but people can go back to their own universities and ask if their degree is equivalent 4th year, and they should be able to tell them as well. But that's the same for any postgraduate courses in psychology.
Yeah, absolutely. So, so guys, if you want to get a bit more of an understanding of essentially the Australian landscape of psychology qualifications, go to that APAC website. But also, if you want to chat with us, maybe through your specific circumstances, please organise a one-on-one consultation. We'd be more than happy to help you out by chatting through your options, possibly with Macquarie University. So we've got another question here. I finished my bachelor's in psychology and I'm currently waiting to do a 4th-year accredited diploma. What type of jobs could I get with a psychology bachelor's degree, as I'd like to start working in my area while I pursue further study toward registration?
Right. So if you're trying to get some good work experience, that would put your application in good stead for postgraduate psychology, because the only way you can become a psychologist is if you've pursued postgraduate qualifications. Then students will come from a wide sort of background of psychology training. One of the areas that you might want to consider is lifeline training, for example. That's a really good background. But even anything that allows you to work with people either in an advocacy role, could be a community setting, a volunteer role, it could be with children, it could be with youth, it could be as even a volunteer in fellowship, for example, is one of the pathways that students come from in terms of getting some more background. We don't really expect, when students apply for our master's courses, we don't expect to see that they've been doing, work that could have been done by a psychologist necessarily. Definitely not. We're really just realistic about the fact that someone's done enough homework and really understands what it is to become a psychologist. So they're really clear in their mind about what it includes, but they may have done something like lifeline counselling or training or working with other people that will give us some more insight to how they know that that's the right career for them.
Yeah, fantastic. And I think that relates a little bit to a question that we've got here, is asking about what the best way is to prepare for interviews for the courses. What are you looking for these courses? Are there particular experiences that are sought? So you touched on that. It's not like Macquarie expects that you've done something that only a qualified psychologist would do. That's right. But some of the examples offered are lifeline, as you said.
Sure.
But how does that relate, I guess, to academic results?
Okay, that's a great question.
Taken into account?
Yeah, that's a great question. What do we look for when we're shortlisting? So it will be marks. We need at least a 2-1 for you to be trained at the postgraduate level. So we do look at marks. We look at GPA as well. We have a look at the sort of work experience you've got. You've got the opportunity to get 2 referees reports, and they can be academic reports. I would recommend that at least one of them be an academic report. The other one can be, maybe you've had part-time employment and you'd like to get some feedback from that employer, and they can pass on their opinion of you as a potential student at Macquarie. So we look at referees reports, we look at your results, we look at work experience. Work experience is not necessarily essential if you've got very good results and you know that you want to be a psychologist. I think it's really important, though, to do your homework. Have a look on the APS website at the different types of careers that are available to psychologists, and be able to answer the question about, why you want to become a psychologist, why you want to train with us here at Macquarie, and what you think being a psychologist, particularly in the area of endorsement, means to you. Great resources on the Australian Psychological Society website under careers, and you'll get some insights there, but be prepared to answer that question when you come along to either the interview or the many multiple interviews.
Fantastic. Yeah, I think that we've got another question here about what the typical characteristics are you look for in a candidate, but I think you covered that quite well there, Joe. So I've got a question. I might throw it over to the students. Matt says he'd be interested in hearing from the students about how they obtain their formal qualification through their 6th year of professional practice. So like, do you get supervised? Do you have to get particular accreditation to as a result of your placement experiences? Like, how does it all kind of transition over?
I can have a go at answering that. So the 6th year is a 1-year internship, and there's a few components to it. There's 1,500 hours of placement, and that's supervised practice. So there's a ratio of, for however many hours you work, you need a certain number of supervised hours. There's also case reports that you have to submit to the board for approval. There's 2. One needs to be an assessment-focused case report, and one is an intervention-focused case report. The board will review those and pass them. Or if you need to do some more work, they'll assign you another one to do. And then there's the exam, and that's the National Psychology exam. It runs 4 times a year, and it's essentially covers what the board considers the 8 areas of competency for a psychologist. And it's a 3-hour multiple choice exam that asks you a range of questions from all of those competencies. There's quite a long reading list for that exam too. So there's also some hours that you need to log in your professional development. That could be training courses or PD that you get through your work. But I think for a lot of students, their PD comes out of their preparation for the exam and the readings that they do for that.
And Cormac, can I just make a comment there, because Maddie's addressed what would be required of someone if they were in a 5+1 pathway. Yep. So that's for the professional side. But if you were to enrol in a traditional 2-year master's course at Macquarie, then there's no exam, there's no national exam, and there's no internship that you're organising for yourself in the 6th year. So the 2 years, at the end of the 2-year program, you would be a registered psych, and then you would go on to get supervised in the area of endorsement for 2 more years. So the programs look a little different for the 5+1 that Maddie and Adam have done compared to the normal sort of 2-year clinical neuro and organisational. And I think that difference is not necessarily well understood.
Yeah, absolutely. And I think it's very typical of shortened or kind of fast-tracked, in a way, postgrad qualifications, and that the Masters of Professional Psychology seems to have that extra bit of kind of intensity to it with the supervised placements, with the exam and things like that, as compared to the 2-year option. Would you say that's a fair assessment, Joe?
Oh yeah, I think masters courses in general are pretty intense. I mean, they're designed to provide you with a lot of skills, a lot of theory, a lot of practice. You know, we're trying to train people that are going to be work ready, and we do, and that's what translates into high employability for our graduates. But we are looking for people that can come in and be prepared to, you know, work hard over the period of training that they do, whether or not it be 5+1 or the 2-year program.
Yeah, absolutely. So on the question of placements, I think that's always an area of not necessarily concern, but of interest for people who are applying for this program. So Maddie and Adam, do you guys have any tips on how to find particular internships? Like, what did you guys look for? Who did you talk to find kind of the things that would maybe suit you the best and provide you with the best experience?
Yeah, I can probably give a go at this one. So in terms of for the 6-year internship, at least, well, placements in general for the master's program, so the academic team work really closely with you to find placements and try to suit them to your preference. So there is allocated staff member to help with placements, and yeah, they sit down with you, say, this is what we've got available, what sort of area of psychology are you thinking that you might move towards, and they'll try to accommodate those needs. I think Maddie and I were both quite lucky in the extent that jobs came out of our placement, so we weren't searching after that. But I know speaking to other students after the master's programs, and it's really about being proactive, like contacting people. You can't really sit back and expect jobs to come to you. You need to reach out and say, hey, I've started the master's program. This is what I'm interested in. I'm interested in working with these types of populations. Have you got any roles coming up? Are you going to have roles in the future?
Yeah.
So yeah, in terms of like placement for masters and internship, I think you go about it that way. And even prior to masters, so if you're in the honours program or even before that, an undergraduate, again, just being proactive, look out for a lot of places like NGOs. They might have sort of low level roles that you could potentially go into. It won't be like necessarily a counselling role or psychologist position or anything like that. But organisations like, I don't know, the Black Dog Institute. I did a placement in undergrad with Drug Arm, which is a drug and alcohol counselling service out in the western suburbs. There's places like Odyssey House, which is a drug and alcohol rehab place, and they often take undergraduate students in sort of introductory roles. So there are positions available. You just need to do some research and be proactive.
Yeah, that's awesome, Adam. And then for you, Maddie, we've got a question more specifically about working in schools as a counsellor. Was your process to begin work in a school different to maybe the typical process, or a process like what Adam would have gone through, or is it very similar across kind of all the fields?
So my pathway into the school was through the practical component of the master's course. So, if you are in a master's course, talking with the placement coordinator about your interest in schools, and they can certainly then do some groundwork with you about reaching out to schools and seeing if there are placement opportunities. There is a formal internship program with the Department of Education that I've had friends apply for, where they do sometimes sponsor your masters with a guarantee that you'll then do your internship with them and then work for a certain number of years in the department. So there's that opportunity, but it has changed a bit over the last few years, and my understanding is that there's particular universities they'll partner with, so I'm not sure what the current status of that is. But certainly with private schools in the AIS network, they all know each other. So if you do a prac at one school, it's very easy to then transfer to other schools or reach out and get to know the AIS school counselling network. So like Adam said, it really is about being proactive and networking. And so in my time when I was on placement at Knox, which then transferred into a role there, I was able to build some connections with school psychologists from other schools. And now I work at Shaw, and that was pretty much because I had been at Knox, and then they had a job come up and I knew them a bit through Knox, and sort of worked out that way.
Yeah, awesome. No, that's really, really good. And Joe, you might be able to answer this question still on the topic of placements. Have placements been affected at all by COVID? Has there been, or just the Masters of Professional Psychology in general? How has the program adapted to these circumstances?
Yeah, I mean, that's a great question. And to be honest, when COVID first came about, there was a bit of reorientating for all of us in terms of how we were going to teach students, which transferred to be online, but also in terms of placements, because organisations were trying to figure out how they were going to manage their workforces. So there was a bit of, I'd say there was a short sort of down period there where we just got our head around what was needed, and then how placements might look, but then organisations came back online. So there was probably a slight delay in when students started placements. We've got all of our students in placements now. I think we've got one student who's just transferring to another placement, but all of our students for this year have been placed, and they were going into more sort of telehealth roles, but the clinic that we have on campus continued to run. So there were some exemptions to the telehealth options, and so people were able to come in and see practitioners face-to-face. So that's for our organisational, clinical and clinical neuropsych programs. So all of those had the opportunities to still do face-to-face work. But Maddie, I think, gave a great example of how the schools adapted, for example,
absolutely.
with students and how that was managed. But a lot of people are learning about telehealth. So, some of the counselling skills that we're teaching now are about counselling skills through telehealth, because that's the environment that a lot of our students are going into.
Yeah, well, that's fantastic. I think it's a really good example as well of being able to adapt to the circumstances, both work-wise but teaching-wise as well, and emphasises that that priority that Macquarie has on being work-ready, and that includes adapting to new ways of working, as has been so prevalent this year. One question that has come up a couple of times is concerns over marks. So if someone doesn't achieve a first-class honours grade, if they're concerned about their GPA, what are their options, do you think, that because if they're prevented from applying for professional psychology or the other psychology masters because of their marks, what are the options for them?
Sure. So let me just say firstly that I think that they're not going to be prevented from applying for anything. And it's very likely that when they put their application in, which is due by the end of October, they may not have their honours marks. So don't second guess yourself. Unless you feel like the chances are remote, very remote indeed, that you're going to even pass honours, then I would still be putting in my application. Just assume that you're going to get a good honours mark, and will help to evaluate your application. So don't second guess yourself and think that you're not going to get a good honours mark, because I do have students coming back to me in the new year and saying, you know what, I got a better honours mark than I thought. Is it possible that I could start? But they can't, because they haven't been through the process, and we're already in sort of session one. So taking on students at the last minute like that is not possible. So I would really strongly encourage students, if they're even half considering it, not to write yourself off. There can be a few, sort of self-efficacy issues, a bit of an imposter syndrome going on there, that you're never going to be good enough. Well, let us help you to make that decision rather than just making it for yourself, because you can unfortunately second guess yourself and then miss out on the opportunity. Yeah,
and I guess because it's not like you guys are trying to be as mean as possible and make as much limitations. Yeah, like Macquarie wants people to be good psychologists. So it's not like people being turned away arbitrarily.
No.
I can imagine the uni would be helpful, and even if maybe the not there at the first opportunity, to provide other options and other pathways.
And we are sort of expecting a bit of a delay in honours results this year just because of COVID. So, if you haven't got your honours results, still put in your application. They close October 31st, and it's still worthwhile putting it in, even if you're not entirely sure what your honours result's going to be. And we can see your GPA as well. And, we like to take well-rounded students. So in the MPP, for example, marks are important, but equally important is having strong motivation to become a psychologist and knowing why you're there.
Yeah, absolutely. Absolutely. Sorry, I've been talking for too long. My voice is starting to go. I think we have time for one more question, guys. And one question, actually, this came to my mind as well, so I'd be interested to hear the answer. Is it possible to switch from a Masters of Professional Psychology to a Masters of Clinical Psychology after completing the coursework? Or maybe just more generally, if you pick one particular master's pathway or postgraduate pathway at Macquarie, are you completely limited to that one, and do you have to start all over again if you maybe want to have a go at another one?
The short answer is, Cormac, you'd have to start all over again, to be honest. And that's because our courses are accredited with a specific set of competencies in mind. Okay. And the way that we run our courses are that we're developing expertise in, being a generalist psychologist, clinical neuro or org, and that starts pretty much from the first week that you're in there, but all the programs are accredited separately as well, so they're not sort of interchangeable as such. Right. So, but I think in the future we might see more bridging courses become available through the APS, so that might be possible in the future, but at this stage, not necessarily easy to transfer from one pathway to the other. I have had students, though, at other universities where I've worked who've got 2 master's degrees. One's in organisational and the other one was in clinical.
Yeah, right.
You know?
Well, I guess also, like, if you only do, like for Maddie and Adam's position, if you guys only do 1 year, like the 5+1 model, it seems less daunting than then to maybe take on 2 years to specialise in clinical or organisational, something like that. Like, would that be right?
Well, Adam, you can probably comment on that. We were talking about this the other day, actually, about having done the 1 year course as opposed to a 2 year.
Yeah, so sorry, it was cutting out a little bit there. Would you mind repeating the question?
Yeah, so we were just talking, Adam, about the difference between doing, you know, what would be the advantages of doing a 1 year course as opposed to 2 years?
Yeah, the advantages. I mean, I guess you're getting that real sort of generalized knowledge and experience, and you're getting into the workforce so much quicker. So I've made significant progressions just in my general sort of life as well, having that practical experience and having a wage, earning a wage. So yeah, I mean, there are limitations in the extent that if you've had this idea in mind that you're going to be like a pretty typical psychologist working in the private sector in like a private clinic or something like that, then, you know, you're probably best off going straight for a clinical program or something like that. But if you're really not sure what direction you want to head in, like if you're questioning whether you have the interest or whether you have the capability or anything like that, it's really good to have that general experience. Like, there's so many students that have been employed in a range of different positions, like organizational roles in a hospital setting, in a school setting, students that are working now in like places like Headspace or telehealth. There's been students that have got roles with, I'm not sure if it's actually confirmed, but they were going for roles within the army or the police force and stuff like that. So the amount of roles that are available to you, it's almost infinite. Like, so yeah, it's very general.
Yeah, well, no, thanks very much for that, Adam. That's about all we have time for today, guys. First of all, I'd like to express my gratitude to Maddie and Adam for joining us and sharing their experiences as students of Macquarie University. So thank you so much to you guys. Thank you, Professor Joanne. Thank you so much for joining us and sharing your knowledge and being so clear and informative about what opportunities lie in wait for people in postgraduate psychology at Macquarie University. And thank you to you guys. I know we can't see you and we can't fully express our gratitude for you all being here today. Have a look at what we had to say. But that pretty much brings us to the end of everything today, guys. So thank you all so much, and hopefully we'll see you at Macquarie University.
Thank you. Thanks, everyone.